Once the governor speak to this great organization. We are honored to have with us this morning Governor Roy Cooper. Born and raised in Nash County, Governor Cooper has served North Carolina for more than 30 years in public office. Beginning in the North Carolina House of Representatives, he was later elected to the North Carolina Senate before becoming our state Attorney General in 2000. Governor Cooper was sworn in just Saturday to begin his second term as North Carolina governor. Please join me in welcoming Governor Roy Cooper.
Thank you very much, Ronnie, and thank you to all of you public servants who are on this call today. I'm grateful for your service to your particular counties and to the state of North Carolina. You are on the ground. You are the ones who hear from people every day. I'm grateful for the input that we get from many of you individually. Most of you know my head of intergovernmental affairs, Jordan Wichard, and we also had Mary Jo Alcoke and Kevin Monroe. We also have our people all over the state who get information from you, and we're grateful for that. Also wanted to, and also forgot Mr. Christie in the western part of the state. I wanted to let you know that here we are in the middle of this pandemic. I've been grateful for the hard work that you are doing. Know that getting vaccines across North Carolina into arms is the #1 priority right now. And I want to tell you about something that is about to happen today. We're going to be opening up the criteria for people 65 and over. So not only people 75 and over will be able to get a COVID-19 vaccine now, but those 65 and over will be, along with healthcare providers. And I know that your health departments and hospitals in your area are working hard, but there are a couple of things that I would like you to do as elected leaders. First, encourage your health departments to use all the supply that has been allotted to them. A lot of counties have the problem, well, we've already used up what you've given us and we need more. And that's what we want to hear, because we want to get you more just as soon as we get an allotment from the federal government. But a number of counties have not yet been able to get out allocations that they have. And I'd like for you as elected leaders to make that an absolute priority, to encourage your health directors to get it done. Also, we are encouraging appointments. And it's also very important that they enter the data into our system to make sure whenever they've given a vaccine that we know about it, because that, we're going to use that information in basing on future allotments. So know that. Secondly, some of your health departments are overworked, understaffed. I know that many of them have worked so hard over the last 10 months. It has been a grueling period. But we are asking all counties for whatever help that you need, whether it's technology, whether it's logistics, answering the phones, appointments, emergency. I've activated our emergency management. Mr. Sprayberry and team have called all of your emergency management operations. And we'd like for you all to make sure that your local emergency management are providing help to local health departments if local health departments request it. And we're also trying to send state help your way. And we've continued to ask health departments and hospitals to ask us for the help. I've mobilized the National Guard to help with this. We are using some of the people who are in contact tracing who are helping with this. So getting these vaccines out are critical. We're also bringing in private companies and working on high throughput sites. So push your health directors to ask for help if they need it so that we can get this done. We also know that the next few months are going to be tough. Regardless of how many people we vaccinate, we know that we will not be able to get the acquired immunity for several months. So our prevention efforts are more important than ever. I ask you all to set examples about wearing masks and social distancing. Many people have become to realize that there are friends and family members and neighbors and people that they know who have gotten really sick or seriously ill. And the insidious thing about this virus is about half the people can get it and never know it. And those are the ones who really can spread this disease, and why it's so important for everybody to wear a mask. Most of your counties are red or orange. And the way we are telling people, assume people that you meet have COVID. And so that can show that you mask and social distance and do the things that you need. And obviously, we would like your help with enforcement. Local governments can pass ordinances that allow some of your employees to enforce safety protocols that we have in place. And so we ask your sheriffs and others to help us with this, because we can save lives. You know, we've got almost 100 people a day dying in North Carolina from COVID. We're about to hit the 8,000 mark, and we know that our hospitals are getting more and more full of people, and ICU beds are getting full. So we owe it to people to let's get through these next few months, get people vaccinated, and let's turn the corner to get out of this. We've got federal help coming down. Legislature has just gone into session. I will tell you, I have probably talked to Republican leadership more since the election than I did the last year before the election. I think we all know that the people of North Carolina have voted for divided government. They've decided they wanted me as governor, and we won by a margin of over 250,000 people, but they've also decided that they wanted a Republican legislature. And so my conversations with the Republican leadership have been, you know, this is what people want. They expect us to work together. So we aim to do that. We understand we're not going to agree on a number of issues, but we've got to compartmentalize, and we've got to try to find common ground. And so we're going to work to try to get this federal budget done first, even before the general fund. And a lot of your schools and small businesses and others will be receiving help from this federal fund. And people who are unemployed are going to be receiving help as well. And I'm talking with legislators about an early appropriations of some one-time private money. I know that we had a dispute over educator pay, teachers and principals, non-certified, community colleges and universities. And you know, I hope that we can do a one-time bonus for them as part of this first coronavirus package that we consider at the beginning of the year. And we'll be talking about that more as well. We have the HOPE program that are set up. Many of you have efforts going on to help people with rental and utility. But this HOPE program is across the state, put out over $52 million, and it's a program that pays landlords and utilities directly to keep people in their homes with the lights on. And we're going to be looking at that program and other efforts with the federal money that has come down to try to help people with rent and utilities.